first of its kind lawsuit out of San Francisco claims several major U.S. food producers contributed to a public health crisis by making ultra-processed food. The lawsuit accuses big names like Kellogg, Nestle, Coca-Cola of knowingly making unhealthy foods addictive. CBS News correspondent Elizabeth Cook has more.
They're on nearly every shelf in nearly every grocery store across the country. Ultra-processed foods now make up over 50% of the American diet.
Our case is about companies who design food to be harmful and addictive.
In San Francisco, City Attorney David Chiu announced the first government lawsuit of its kind against 11 companies that manufacture ultra-processed foods, including breakfast titan Kellogg and beverage maker Coca-Cola, accusing them of using unfair and deceptive marketing to sell food.
We've known for a long time that the ingredients in many of these ultra-processed foods are unhealthy. Why now?
We have all suspected for a long time that food that is not food were likely not good for us, but it took many years for the science to catch up.
Research has linked ultra-processed foods to obesity, type 2 diabetes, and cancer. In a statement, a trade group representing many of the companies named in the lawsuit said there is currently no agreed-upon scientific definition of ultra-processed foods, and that calling them unhealthy is misleading to consumers.
There's a clear definition in California law on what ultra-processed foods are. We look forward to having that discussion in court.
San Francisco has a track record of taking on big business, previously suing and winning multi-million-dollar lawsuits against big tobacco, lead paint, and opioid manufacturers. In San Francisco, Elizabeth Cook, CBS News.
For more on this, let's bring in David Chiu. He's a lawyer for the city of San Francisco. Thank you so much for being here. So what is the definition of ultra-processed food under California law?
Well, let me first start by saying ultra-processed food is really food that's not food. It's not found in nature. It's created by an industry that has designed all these new chemicals. And what ultra-processed foods are is they combine artificial chemicals with industrialized processes. The definition under California law essentially says if a food has any of those chemicals, and if it is high in fat or sugar or salt, it's considered ultra-processed food.
You know, I was thinking, well, people could just choose to not eat it. Nobody's forcing me to pick up a bag of Cheetos, for example, but you guys are arguing that they're knowingly making these products more addictive, right?
Absolutely. Well, first of all, it's important to note that scientists will tell you that in our United States food market, close to 70% of our foods are actually ultra-processed foods. So there really, unfortunately, isn't consumer choice here. And this is a point where the industry needs to look at itself and decide if they're going to choose to continue to create products that they know are harming people. And all the studies in recent years have shown the inextricable link between ultra-processed foods and horrific chronic diseases, type 2 diabetes, fatty liver disease, heart disease, kidney disease, and so on.
Your lawsuit also argues these companies violate the state's unfair competition law and public nuisance statute. What does that mean?
Well, first of all, they are using deceptive advertising techniques. And they took the playbook from big tobacco because years ago, big tobacco companies acquired major food companies, and then the industry consolidated. And big tobacco literally injected not just their addiction scientists, but their marketing techniques and how to get folks to purchase these products. In particular, how to target kids, bombarding them with product messages with Tony the Tiger and Fred Flintstone and Paw Patrol, working with companies like Disney and Nickelodeon to target kids and in particular low-income communities. So we are looking to address the deceptive advertising, but also we have had to expend very significant costs as a city with our healthcare systems, with patients, and we want to be to receive compensation for what has happened, restitution to help offset the billions of dollars of healthcare costs that have been imposed on us by an industry that deceived us and made billions of dollars off us.
David Chiu, thank you.